when I first started hearing about MND, and I'm aware I'm quite young, but my interest started when I was very, very young. The kind of main thing was to say that MND or ALS, it's a motor neuron disease, but your brain remains intact. So, and that was kind of used to highlight the awfulness of the disease, because you're slowly getting paralyzed, but your cognitive function stays totally the same. And that was what was believed for ages. But now we know that that's not the case, that up to 50% of people with ALS end up having some level of cognitive problems. And I don't necessarily agree that makes it any easier. You could argue that that's worse, especially for caregivers. But it's important in many stages. So as I said, it's important for caregivers and the information that we give them and the tools that we give them. It's not the same to provide care for someone that has the cognition totally intact to someone that hasn't. And that's kind of the key element and why we want to focus on it. There's some research suggesting that actually patients with cognitive problems end up developing a faster progressing disease. So they have a shorter lifespan after diagnosis. And that's a huge tool to have, because right now with ALS, once you get diagnosed, we have very little room or tools to tell you whether it's going to be 6 months or 3 years. However, if we kind of start to know those links, that could provide a huge relief for patients as well. Synaptic density and loss of synapses has been correlated to neurodegenerative diseases in general for a long time now. So what we want to do is we want to correlate synaptic loss in particular areas of the brain, and whether we can target that and pinpoint that to particular cognitive symptoms. So if you have synapse loss in a kind of particular type area of the brain, whether that correlates with problems in cognition in a certain aspect. So say language production. So whether your language area of the brain is more affected, and that means that you have more problem with it. The problem is that synapses are kind of hard to study. They're very small. We have loads of them, and they're insanely delicate. So that's always been an issue, especially when it comes to synapse number. So for the longest time, the main tool that we had, and it's the one that we still mostly use, is electron microscopy, which is costly and technically demanding. And since no machine is better to count them than humans, that means that a person has to look at tens of images and manually count synapses. So you can see that for researchers is not the ideal. So we now have a huge tool that's called array tomography. So this is a high resolution imaging technique that kind of beats that problem and allows us to use more mainstream or easily accessible microscopes to image, in my case, human postmortem brain. So from people that have generously donated their brain to science. And we get to study those synapses in fantastic detail. So we get to have a machine count them for us, and we count them at the tens of thousands. So it's a super high throughput. So it's a great tool for that. We can stain for different proteins, so we can even assess the composition that synapses have. So it's a fantastic tool that allows us to kind of hone in a bit deeper into synaptic problems. I'm still in the main process of it all, but we have seen that basically, so we measure two things. We measure synaptic density, so basically synapse loss, but also cortical thickness, so brain thickness anyway. And the logic of it is that in a later stage of the disease, you have cell loss besides synaptic loss. So you lose volume of brain as well. And if the synaptic density remains the same, that means that you're also losing synapses. Because if you have the same amount in lesser volume, then you still have less synapses. So what we have seen is that in ALS patients that have zero cognitive impairment, there's only cortical thinning in the motor cortex, and all the other areas of the brain that we've studied remain intact. So both in synapse count and thickness. However, in patients that have that cognitive impairment, the areas where we'd expect that degeneration, we either see loss of synapses, especially in the prefrontal cortex. And now I'm looking at Broca's area, so the area specialized in language production. And in that one, we see cortical thinning. So we see that there's a kind of further stage of degeneration going on there. And now, because we also have the information on their cognitive status and which parts of their cognition were most affected, whether that's, say, like language production, memory retrieval, spatial awareness. The next step is to kind of correlate those particular areas of the test with different areas of the brain.